$6.5 billion of medical debt relieved, taken off of their shoulders. And it's a huge benefit to people. It's a financial benefit, clearly, because they no longer are carrying this debt, which means that when they're out there applying for credit, their credit report isn't dinged, they're able to access credit in a more affordable way or access it at all. It also helps their emotional well-being. Having this debt can be a real psychological burden. Some people feel shame for not paying what they feel like they owe, even though nobody asks to get sick. This isn't debt you choose to incur. It lands in your lap, often in very heart-rending ways. And then it can have physical consequences too, because it may affect your care. And we're gonna flesh that out a little bit in our discussion today. The program was the brainchild of my predecessor, Governor Roy Cooper, and his Secretary of Health and Human Services, Cody Kinsley, and their team. And as part of that debt relief program, it wasn't only about wiping out people's past debt, but it was ensuring that the 99 hospitals that participated, that they also have better programs as it relates to charity care to make it less likely that people in the future also incur debt going forward. A really positive development. And I want to thank our hospitals, the 99 acute care hospitals, for being part of this program. Unfortunately, this last week, the Trump administration is trying to go backwards. It's trying to make it harder for programs, particularly the credit reporting agencies, to not report medical debt and hold it on their credit report, which hurts people's access to credit. And we've been, so I have written the 3 credit reporting agencies, Experian, Equifax, and TransUnion, urging them to continue to agree with North Carolina's program, which is when this debt has been relieved by the hospital, they should take it off the credit report, and so it doesn't hold people back. It should be about trying to make it easier for people to have more opportunity to thrive, not put more burden on their backs. A final point I want to make in my preliminary comments has to do with Medicaid. Medicaid is the largest provider of health care in the state. 3 million North Carolinians are beneficiaries. It is the leading healthcare financing mechanism. The legislature has failed to fully fund Medicaid, and as a result, the department has found itself to be in a very uncomfortable position where we've had to reduce rates to providers because we don't have money. We cannot spend money that we do not have. So I have been urging the General Assembly multiple times to fully fund Medicaid, and they have yet to heed the call. Even though both chambers concede that the state doesn't have enough money, both chambers concede how much money we need, they just refuse to come to a deal. They're allowing their differences on other unrelated issues to prohibit them from doing this. And so they're willing to allow people's health, people's well-being, people's lives to be a bargaining chip in matters that have nothing to do with this. And it's really immensely upsetting. So with that,